Hi, I'm Dr. Gerald Evans, and this is your 101 for today. All right, so our next 101 topic is COVID-19 vaccines. So let's get into the questions right away. Are the COVID vaccines safe? And the answer is, yeah, they're very safe actually, and they're probably going to pan out to be one of the safest vaccine platforms we've seen. There are serious side effects that have been described, but they're very uncommon. And the incidences really are vary depending on what group you're in. And an example of that would be the thrombosis risk that was seen with the adenovirus vector vaccines like AstraZeneca, in which, the overall average was about 1 in 80,000 for the development of serious clots. And that occurred most commonly in middle-aged women. If we look at the myocarditis signal in mRNA vaccines, which has gotten a lot of discussion recently, we know that in young men, that risk may be as high as 1 in 10,000, but in other groups, it's probably lower. And what's interesting about the myocarditis is that it's actually mild and tends to resolve quite quickly without a lot of sequelae in over 95% of people who have developed it. So let's look at a quick little bit of data. Here's some data on anaphylaxis, an allergy to mRNA vaccines. This is from a very recent study that looked at over 11 million, almost 12 million doses of mRNA vaccines in the US. What they found was the incidence of anaphylaxis was actually 9 cases per million recipients, so very, very few. A little higher in women than in men, but probably not necessarily statistically different. And what was interesting is all of these anaphylaxis episodes were virtually mild most of the time, and they really didn't contraindicate second doses as long as they were done under the supervision of an allergist. And a recent group published 159 cases of people who had anaphylaxis with their first dose, and they were all safely given a second dose with that kind of supervision. If you look overall at adverse effects, especially of the mRNA vaccines, which is of particular interest to a lot of us here in the hospital sector, the signals that popped up that suggested that there was a slight excess in cases related to the general population was really this myocarditis signal, a little bit about venous thromboembolism, and interestingly enough, acute myocardial infarction, which really is difficult to sort through on that. But essentially, all of the other things which have been described and people have talked about really don't occur with a lot of excess above what we see in baseline for people who don't get the vaccines. So really, in summary, what I can say is that these vaccines are very safe. The incidence of some severe side effects is really uncommon and in some cases rare. And I think in the long run, we're going to find out this is a great way to administer vaccines in the future.